joining. We're going to get started. I'm Sapna Desai, and I am so pleased to welcome you all here today. I'll tell you a little bit about SRHM, and several of our team are here today. I'm joined by our senior editor and managing editor, Sundari Ravindran and Pete Chapman, who you'll meet shortly, as well as Nihal Saeed and Luca Stevenson from IPPF. So we're all here, and this is intended to be really an informal discussion and an opportunity for you all to ask questions and for us to demystify anything about the call for proposals, as well as just submitting proposals in general to the journal or anything else you'd like to ask in relation. So as a bit of intro, Sexual and Reproductive Health Matters, SRHM, is a peer-reviewed and open access journal that has focused on, and I hope you already do know who we are, that is really focused on SRHR, particularly with the focus on emerging issues, neglected issues, and most importantly, the voices of those who aren't necessarily always heard in the peer-reviewed literature. We have a focus on ensuring we publish rigorous evidence, and what we mean by evidence is broad. It's evidence that represents the lived experiences of those experiencing SRHR or sort of exposed to various aspects of SRHR issues, service provision, delivery, use, communities that aren't traditionally heard from, marginalized communities, the vulnerable, as well as really ensuring we see a range of methods. So we'll talk a little bit more about the types of articles we publish, but I just want to emphasize here that for us, evidence is really a 360 view on the experience of SRHR and the advancement of SRHR globally. Something we do as a journal in partnership, I guess, as our broader organization, SRHM, is really focus on knowledge to action. So the knowledge that we publish, that we help generate, disseminate, is also directly linked to a whole series of activities and efforts around influencing action. And you'll see as we speak a little bit further in the conversation, one of the things we ensure is that, unlike a lot of journals, that the articles we publish have a very clear link to rights. They're grounded in rights, but they also are grounded in implications for action. Next slide, please, Jessica. So I've already told you about our mission and the facilitation of knowledge, and I just want to say, before I turn over to the IPPF team, that SRHM as an organization, we are global. We have hubs around the world now. We have hubs in, I think, 4 different regions now that are emerging. Our team, I'm based in India, in New Delhi. We have another editor in New Delhi, one in Spain, one in London. So we are global, not just in sort of our speech and who we publish, but also really where our hubs are. We're about to start a new hub in the Middle East region. We have partners in Northern Africa and Francophone Africa. We have partners in Latin America and South Asia, etc. So this is really an opportunity for us to work with IPPF and your partners globally. So we're really excited about that, and we're deeply committed to that. And as we go through the evening, we hope that you sort of see how we practice what we preach in terms of ensuring that we provide the support that's required to be able to publish your evidence and your insights in the journal. So at that, I'm really excited to turn over to Nihal and Luca from IPPF. We have been talking about doing something jointly for quite some time, so I'm happy to see this in practice. I think we're starting with Luca, so over to you.
Thank you very much, Sapna, and very nice to meet you all, to see you all here in the webinar. My name is Luca Stevenson. I'm a sex worker and currently the global lead on community engagement and partnerships at IPPF. And just to give you a bit of background on IPPF strategy when it comes to community engagement. So we know, and you will know as well by attending this webinar, that many marginalized communities have faced many obstacles when it comes to SRHR. And these obstacles are, of course, linked to discrimination, criminalization, and structural exclusion, both from services, but also from policy making and generally from society. And we've been discussing with SRHM for a while now to develop a program, an initiative that would help to amplify the voices of the communities. So you will have seen from the call of proposal that the partnership include not only just the for proposal, but also a series that we call From Knowledge to Action that would include blogs, for example, webinars, etc. So please follow up on the communication related to this initiative. And Nihal will go more in details about the priorities of this call, the communities that we want to engage with. But what we really want to highlight is that in the current context of anti-gender, anti-rights backlash, I know we can't really call it backlash anymore, but the kind of solidification of anti-rights and anti-gender, we see the impact on communities, in particular when it comes to access to funding, access to services, and wider exclusion. And we really hope with this initiative that we can highlight some of the amazing work that our membership are doing in partnership with communities and really centering the equitable relationship between IPPF member association and marginalized communities. So I think, Nihal, do you want to take on from here?
Yes, sure. Thank you so much. Thank you, Luca. Hi, everyone. I'm Neha Saeed. I also work for IPPF, the International Planned Parenthood Federation, and my role is a senior technical advisor for research and partnerships. Within IPPF, and specifically within the context of IPPF's current, strategy, the 2028 strategy, we have an intentional focus on shifting, knowledge production. Going from the traditional ways of producing knowledge, and from our role as IPPF in engaging in research in terms of implementing research studies, to actually supporting member associations to create knowledge, because we know that a lot of times they do hold, they are knowledge holders, they do contribute to the knowledge production nationally, regionally, and globally, but not necessarily they're being recognized for their role in that process. So that initiative is really an intentional way from us to center them in the knowledge production, but also to recognize the partnerships and the quite essential partnerships that they hold with communities, because a lot of them do work with communities, to provide services and to advocate for quite essential SRHR issues and expanding access. So that was, as Luca mentioned, those were some of the key motivations for us to create that initiative in the way that it's being designed now, that it's looking at those intentional collaborations and the effort that has been done with IPPF member associations and SRHR providers, and then specifically as well with communities and community-led organizations. Because a lot of times within the knowledge production, we do not center them as knowledge producers or knowledge holders. They are sometimes, viewed as recipients of knowledge or just participants in research or key informants, but not the key authors of academic papers. And we're quite pleased to be doing that jointly with SRHM because of that alignment in our vision. If we can go to the next slide, please, Jessica. Thank you. So for this initiative, we also want to center topics that haven't been that much discussed within the literature, that speaks and that addresses the issues or the sexual and reproductive health issues to the most marginalized and underserved communities. Those issues, for example, include unexplored SRHR issues that are of importance to underserved populations, such as, for example, abortion access to trans men, cervical cancer among sex workers, SRH in prisons and closed settings, and so forth. So really want the topics to address those underexplored issues. The second type of issues that we're looking for in the proposals is research as well as practice learnings and other types of knowledge that does address the structural and systematic barriers to SRHR. So not only just looking at access to services, but trying to dig deeper into what are those structural and systematic barriers that look at exclusions from SRH services that cuts across, the intersectional aspects, be it around race, around gender, around sexuality, sexual orientation, and so forth. The third type of topics that we're looking at is topics that, or partnerships, innovative partnerships between community-led organizations and SRH providers and IPPF member associations. That also could be in the field of research, could be in the field of advocacy and policy influencing, and could be in the field of communications and social and behavior change communications. So we're also, in terms of, the thematic topics, we're quite open as well. And Sundari would speak more to the type of submissions that SRHM accepts as a journal. And then the fourth topic that we're also interested in is around community-led evidence for advocacy. So examples where communities themselves have organized themselves to generate evidence that has been used for advocacy purposes and social change. And then the fifth type of topics is topics that are very much fighting back. Because as Luca mentioned, this initiative is within IPPF's broader initiatives of fighting back the rollback of rights, the backlash or that sort of systematic and mobilization against sexual and reproductive health and rights issues, against social justice issues, gender justice, and so forth. So we're really looking at those kinds of, knowledge pieces around knowledge production that really speaks about resistance, resilience, and responses to whatever we're seeing in terms of attacks, be it at national, regional, and global level. So those are the key types of topics that we're looking for as part of this call for proposals. And we're very happy to take any questions you may have around those if you want to ask specifics, but also as well if you want to reach out to us after the webinar. And then, I think I'll hand over then to, I don't know if it's Sundari that's coming next, Sapna, or that's back to you.
Over to Sundari.
Hi, I'm Sundari Ravindra, and I'm senior editor at SRHM. Can you go to the next slide, please? I'll just tell you a little bit about the kinds of articles about which you can send your abstracts in the call for proposals. So we have the research article. The research article can be based on, like you say, a research study or an evaluation study that you may have conducted. And this is a largish article type, about 3,000 to 8,000 words, and follows the usual research article format, where you have an introduction with a literature review, a methodology section, which gives conceptual framework and the study design, sampling, etc. Then the findings, discussion of the findings, and the conclusions. Then we also have review articles. I'm not so sure how many of you will be using this kind, which is actually a systematic review of studies published on a specific area, or what we call a scoping review. And these are also around 8,000 words, up to 8,000 words allowed. The three other types of articles that may be of special interest. One is the commentary. And in this is, you highlight an emerging or a contemporary issue, critically engage with it, and draw attention to it. Like, for example, what kind of measurements exist for, documenting there was a recent article about that. What kind of measurements for documenting the efficacy of abortion programs? And the commentary was talking about how people not only just carry out abortion care, but they help people get an abortion, they accompany them, and these kind of indicators or these kind of values should be included in the evaluation, and not just how many abortions were conducted and so on. So it's a new perspective on something, and or a critique of something, saying, and with enough background literature, you will draw on that. And it's a short article about 3,000 words. A perspective is like, this is what I believe should be done. Nobody is doing this. And this is my point of view based on my personal reflection. So it's a point of view based on one's own personal reflection. You don't need to draw on existing literature and so on, but just say that I believe this is the way things have to be done because of ABC and so on. So that is also a short article type, up to 3,000 words. And then I think maybe of a lot of interest to many of you would be the policy and practice type of article, which is a descriptive article. And it talks about your field experience and, your lessons that take away from that, your reflections based on that, something that you did not anticipate but was there, or it's also your experience as a service provider and what are your takeaways from that and so on. And this is also up to 3,000 words kind of. In this policy and practice one, you can talk about your advocacy initiatives, your campaigns, workshops in the communities and takeaways from that, and so on. But what we are looking for is your insider perspective. Like, you've been there, you've seen it, and this is what you have to say about it. So all of these are available in the information for authors on our website. Over to you, Pete. And once you're done, I may talk a little bit about the mentorship. Pete?
Thanks, Hilary. Hello, everyone. My name is Pete Chapman. I'm the managing editor of SRHM, and I'm going to talk briefly today about the proposal submission process. So, as Sundari's discussed, the journal-specific output of this collection between IPPF and SRHM is going to be a curated collection of published articles in the open issue of SRHM. APC waivers will be provided for selected manuscripts that are accepted following peer review. And in order to get to that end product, what we're asking for at this point in time is for your proposals. So rather than submitting full manuscripts at this point, what we're asking people to do is for interested groups to send us their emailed proposals, which we will compile, and the editorial team, once the deadline has passed, will assess all of the different proposals and select the ones that they wish to take forward for the collection. So hopefully it's at this point a fairly simple and straightforward process. What we're asking at the moment is for interested groups to download and complete the template proposal form, which contains guided questions that will enable the editorial team to assess the merits of each proposal in a standardized way. So the form itself can be found in the call for proposals, which is on the journal website. As I say, we're asking for people to download and complete the form. Each form contains specific sections that we would like people to address in terms of its suitability for the journal and also for this collaboration. So we're asking for people to really look at the aims and scope and the information for authors before they complete their proposal form, just so that they can tailor it really towards what SRHM prioritizes in terms of, for example, a strong rights lens, and where there has been partnerships, we're looking for equitable collaboration and partnerships, and whether the work is part of a larger project, potentially associated with other publications, all of the things that the editorial team might want to factor in. And as Sundari's discussed, the different article types that are available, we're asking groups to let us know which article type they would submit the manuscript as, should they be selected. We're also asking, where applicable, for a brief description of prospective ethics committee approval or exemption, as well as informed consent processes in the study setting. So this is a key consideration for the journal. And each of these sections within the proposal form links to the relevant section in the information for authors. So there are hyperlinks within the form itself, where you can actually click on to go to the section within the information for authors, so you can see exactly what we're looking for. I should also point out at this point, but again, can't emphasize this enough, if you have any questions about the proposal form itself, editorial policies, or anything related to something related to the journal, please don't hesitate to get in touch. My email address is on the information for authors, and there's a contact button as well on the information for authors page of the journal website. So any questions whatsoever, please don't hesitate to get in touch, and we can discuss anything that you might want to chat about. So the call for proposals is live at the moment, and we're asking for proposals to be sent in to me by the 2nd of August. So there's plenty of time sort of to discuss and submit the proposal. And as I say, any questions at any point, please get in touch. But hopefully it's a fairly straightforward process. But yeah, I think that's pretty much all we want to discuss from the process itself at the moment. If you have any questions at the moment, then I can discuss those later.
Thanks, Pete. Thanks,
Yeah.
Sundari, Nihal, and Luca. We are now open for questions. Sundari, sorry, were you going to say something?
No, just a minute. I have a few things to say about the proposal and the mentorship. So one is that in the proposals that you submit, there is a short summary of your proposed manuscript that's requested. And one of the things that I would like to suggest is that, unlike some proposals where people talk about this is what we intend to do, we would like your proposals to say what your manuscript actually contains, including your findings, or what your new perspective is, what your reflections are, and so on. So what the meat of the manuscript has to be present in the proposal. And the second thing about the mentorship is that the proposals that are selected for development into full manuscript, each team will be paired with a mentor who will help them to finalize and submit their manuscripts. So the work is still yours, and the kind of support that you need is for you to ask the mentors, and they will provide you with that support. You are the decision maker about the final shape of the manuscript. And after submission of the manuscript will undergo external peer review, and the mentors will again help you navigate the external peer review comments and help you help the teams revise their manuscripts, maybe 1 or 2 rounds, and then make a revised submission. So that's all from me. Thanks.
We really want to see, and hear from you and your evidence and the different experiences as practitioners, service providers, people working with communities to really ensure that these voices are elevated. That was the absolute motivation, and we're really committed to making that happen through this effort, as well as what the journal does generally. I don't see any more questions, but please feel free to write in, and I'm going to turn over to Nihal and Luca to close us out. But just wanted to say on behalf of SRHM, we're really looking forward to working with all of you and also to creating a partnership that goes beyond just this program, of course. So thank you all so much for being here, and thank you again to our IPPF partners. Over to you.
I can say briefly, Nihal, that's okay, and then I leave you the last words. Yes, I think everything has been covered, but really what we hope to achieve with this partnership is also to look at issues that have been historically under-researched and under-explored. So we know for the lots of the key population, the marginalized communities we are collaborating and working with, for example, the angle of HIV has been prioritized over the wider angle of like SRHR, for example. So in this context, IPPF is leading on research on access to safe abortion for sex workers. So we also want to explore issues that have really been historically underexplored and under-researched. And I mentioned this as many IPPF members will also be at the International AIDS Conference in Brazil that is starting on Sunday with pre-conferences. So if you are attending, come to the IPPF booth, say hello. We will also be collaborating with different communities there. And if you want any information, as said, you have emails of the team, so feel free to reach out, and we look forward to reading your proposal. Thank you very much.
Thanks, Luca. And yes, from IPPF side, we're very much grateful, for that partnership with SRHM and that, opportunity to elevate communities' voices and providers' voices, because we know that knowledge, is there. We know that, in a lot of those big conferences, Luca mentioned the AIDS conference. Last year was the ICFP, the International Conference on Family Planning. And earlier this year was Women Deliver, and many more conferences that the community does. And they show up. And they show up with innovations, with research, and quite impressive, work that is still not there in the academic, and then the peer-reviewed sort of space. And that is one really small initiative to help, bring that knowledge and that evidence into that space, because as Esther mentioned and as Sapna mentioned, that could be really powerful in terms of, in delivering and influencing that change that we want to see in policy and service delivery, in the way that we do research at large with and for communities. So we invite you to please, if you have ideas, if you have previous work, if you have previous, reports that you've published and you think that they can be, sort of drafted in a way that is corresponding, to the evidence that is being presented in a peer-reviewed journal, please submit a proposal. Please also get in touch, around the eligibility in terms of, the affiliation with the IPPF, and we're quite flexible. We really want to see knowledge from within the Federation, but also at large, the partnerships with the Federation and how that can be elevated into the knowledge space. So thank you so much. And thank you so much, SRHM, for the platform. And we look forward to hearing from you. Thank you.